All right, welcome to today's live stream. If you're new here, I'm Mercy, and in today's live stream, I just want to talk about what we call eye flutters or vision flutters. Yeah, have you ever experienced uh, like in your vision, there are these small dark spots that drift about in your vision as you move your eye. You see, like these small dark spots are moving about as you move your eye. Usually, they may tend to appear to you as if they are dark specks or strings or cobwebs, sort of flying dark or gray objects that keep flying about in your vision. And they tend to be very prominent if you are looking at a white background. And when you focus your eyes to look at them, they dart away from your vision. When you get a glimpse of them, you see them move away from your uh, focus point of vision. So these are called uh, vision floaters or eye floaters, actually. So there are a number of things that can bring about vision floaters, but the commonest is age related. As you age, your vision, I mean your vitreous, which is the gel-like substance inside of your eye. It is found between the natural lens of the eye and the retina. And that gel-like substance is the one that gives your eyeball that round full. This gel-like substance called the vitreous humor liquefies. The vitreous humor is composed of three things mainly. The common that make it's made up of water, a protein, and a carbohydrate. So the protein in the vitreous is collagen. And when this vitreous liquefies, the collagen fibers uh, scatter in the vitreous. So these scattered collagen fibers form clumps that float about in the vitreous. And these clumps obstruct some light that is passing through the vitreous, casting shadows on the retina. So these shadows are actually the ones that the retina interprets as, that the brain interprets as images that are floating about. Okay, so what you see in the outside is actually not in the physical, but they are clusters of collagen fibers that are floating about in your vitreous are the ones that you're seeing, like they are dark specks or strings or cobwebs that are floating in the outside as small dark shadows. Yeah, they may appear like tiny insects that are floating depending on the size of your floater in the vitreous. So that is basically how these vision floaters come about. So if you're experiencing any of them, That is, that's what's happening in your eye. So other conditions may also contribute to vision floaters in your eyes. And these conditions include inflammations in the back of the eye, such as posterior uveitis. It can also contribute to your developing these floaters. Another one is bleeding in the eye, especially bleeding into the vitreous. And this bleeding is common in conditions such as retinal detachment, retinal tears, and diabetes, hypertension, and also in trauma to the eye if your eye is directly injured and it bleeds inside. Also, you may find vision floaters in conditions like if you're, for instance, you have developed this retinal vessel blockage, like retinal arterial occlusion, retinal vein occlusion. You may also experience bleeding in your eye, and it may result to floaters in your vision. Also, following eye surgeries um, and also certain medications may contribute to your development of floaters in the eye. So, when should you get worried about floaters in your eye? One, usually if you visit the hospital with this complaint of seeing um, maybe this one or two tiny dark spots that are floating about in your vision, your doctor normally counsels you and advises you to observe and wait and hold on, because this is not a life-threatening condition if it's not severe, um, and it may not necessitate immediate intervention if it is not severe and affecting your vision significantly. Actually, most people have at least a flutter in the eye, most people. So it is something that is not so threatening. Um, that is what I can say about it. And then also, usually the treatment, the management is conservative at this in the beginning stages, if it's not actually causing any disorganization to your normal vision as you go about doing your normal routine work. So your doctor will eventually just counsel you and advise you to just ignore that flutter in the eye and don't give it attention, because once you ignore it, you may even forget that you have a flutter in the eye. Personally speaking, I got one in this eye. At the beginning, when I first saw it, it used to disturb me. But as time went on and I understood what it meant, yeah, I simply spend days without even imagining that I have a flutter unless I really bring it to my attention. So what I simply want to bring is that flutters are not a big threat, are not a big threat if they are not too many. They are not a big threat. You can stay with them. And then also, these flutters, sometimes after some time, if the vitreous settles, yeah, they can settle at the bottom by gravity. They can settle at the bottom and you stop seeing them and it disappears. Yeah, so, but if they've not yet settled, so it means they will keep floating about in the vitreous and you keep seeing them. So Taking you back to when does one need to see or to worry about eye flutters? Number one, if you notice a sudden increase in the number of your flutters, if you've been having one or two flutters or three in your eye, then all of a sudden you notice you're having 10, 20, 30, too many that you can't even recognize the number. There are too many. You have to go and see your medical doctor. And then if you're seeing flashes of light, yeah, a flash of light may appear like you see like there's a sudden light such as like a beam of a torch in your eye and then it disappears. Yeah, that's what we are calling flashes of light. Or they can also appear like a lightning. Yeah, that is a flash of light. So if you're seeing these flashes of light in your vision, yeah, you should also get worried and see your eye doctor, because it may indicate maybe you're starting to develop a retinal detachment or worse. And then also, if you start experiencing darkness on the sides of your vision, you're seeing like there's this curtain of darkness that is coming on the side of your vision. It could be on the lateral sides, it could be from above coming down, it could be from down coming up. It depends where a shadow can come from any side of your peripheral vision. So once you're seeing darkness on the sides, it may also mean that there's a problem in the retina. Maybe it is now detaching and closing off. Some people will complain, may not appreciate exactly what it means to see darkness on the sides of your vision, but some people usually, with my experience, I've had some people who come claiming whenever I'm looking straight, I see as if there is somebody standing on the side. I see a dark shadow, like there is a human being standing by my side, or yeah, I just see a shadow like there is an image, there's somebody standing on my side. Others will explain like I feel I'm under shade, even if it's daytime. I get this feeling like there is a shade over me, or I'm under shade. So some people explain it that way. Sometimes it's very difficult for the patient to explain certain symptoms. But if you can understand the symptom, you will know exactly what the patient is meaning. So some people will experience that. So in summary, floaters are very common among the population, especially your risk of having floaters increases with your age, because most people, as they age, they develop floaters. So age is a big risk factor for floaters. And then uh, taking into consideration, these floaters don't have a specific shape. There are different shapes in different people's eyes. Yeah. They simply take a shape of the clamp that has happened, that has how the collagen fibers have clamped in the vitreous. It looks like a string. If the clamp looks like taking a shape of like an insect, you will see, yeah, you will see a dark spot which looks like an insect flying about. If the floater looks like a cobweb that is big and all over, you will see a dark spot that looks like that. So With the shapes, they take different shapes depending on how the collagen fibers are clamped in the vitreous. Uh, yeah, that is what I want to say about floaters. So if you're experiencing floaters in your vision, yeah, and they are really giving you some disturbance, I advise that you go and see your medical, your eye health worker. Yeah, especially you visit a hospital where they are equipped with equipments to use to examine your eye thoroughly and look at your fundus also as well, so that you get a comprehensive management, because the management for eye floaters is different from person to person depending on the number of eye floaters. It could be surgery, it could be laser. Yeah, so your doctor will be able to decide what to do for you, but in most times the treatments are conservative, or if it is really wanting, then laser can be done. Rarely do they do surgical removal of the vitreous, what we call vitrectomy, because it is associated with a number of complications. So your doctor will look at it and put in consideration what to do for you accordingly. So yeah, that's what I want to speak to you about vision floaters. So you can leave me a comment down below on what you think about this. You have a vision floater? Yeah, any questions that you want to know about vision floaters, click the subscription button, subscribe to my channel, and give this video a like. So I've come to the end of this video. Until next time, bye.